Well, welcome to our next plenary session. The plenary session this afternoon is titled Best Practices, Strategies to Achieve Impact. And our moderator this afternoon is Dr. Jeannie Birch, who is the Lawrence C. Neusdorf Professor of Urban Research, Chair of the Graduate Group of City and Regional Planning, University of Pennsylvania School of Design, Co-Director, Penn Institute for Urban Research. She is the co-author of City in the 21st Century series, has written several books and numerous peer-reviewed articles. She is the commissioner on the New York City Planning Commission and a member of the jury to select the designers of the World Trade Center. So please take a moment to welcome Dr. Birch and our panel, and we will get started on our next plenary session, Best Practices and Strategies to Achieve Impact.
Thank you, Kate. Good afternoon, everyone, and panelists. Here we are. We're midway through this information-packed conference. Our heads are swirling. We're all energized with all the new information being brought forward. It's time to take some time to reflect, don't you think? How do we develop new knowledge? And how do we develop new knowledge that has impact? That's the subject of our panel today. And in particular, we want to drill down to the question of how we develop knowledge with regard to global women's health. Now, we're going to approach this question from a platform of basic facts. And we keep repeating these facts because they're so very important. First of all, urbanization is ongoing, and it shows no signs of abating. And cities that are experiencing this phenomenon, whether they're in the global south or the global north, are dynamic places. And at the very least, they contain shelter, transportation systems, public space, food markets, healthcare facilities, other civic places like religious institutions or community centers. And they do this for the better or for the worse. The amount, the location, the quality of these components really varies quite widely. And ideally, municipal governments and their partners in the private and philanthropic or civil society sectors provide basic services to ensure the well-being of the residents. Clean air, clean water, waste disposal, education, access to routine and emergency health care. We know, however, that cities everywhere do not perform these functions equally, and in no city in the world does it do it perfectly for every resident. There's much room for improvement. And in fact, I think the panel would probably agree, and you in this room would agree, that this is the challenge of the 21st century. We know, however, that there are places that are succeeding in responding to the challenges and in single or multiple aspects, and they've done this in ways that have impact. We have Sheila Patel right here, who is an indicator, a symbol of someone who has done that. And it is this arena today that we want to occupy. And we have at least two questions here that we want to focus on, and this is what our panelists are going to help us with. First, how can agencies, such as foundations, identify the activities that will have impact and, in fact, might turn into best practices? That's the title of our panel, Best Practices. And so we're also going to turn this question around and say, what are the best practices for foundations in this type of work? But before we go there, I think we should take a moment to think about just what this thing, best practice, is. It's sort of a catch-all phrase, and we need to sort of get our hands around it. So what is a best practice? A simple answer is that it is something that has attacked and solved a problem. But then we need to ask, who says it's a best practice? Is there some sort of verification or validation? Is there a third party, or are there benchmarks that tell us that it's a best practice? We also need to know in what context the best practice has emerged. What were or are the political, the social, the economic conditions, the nature of the leadership, the resources required? Knowing all this, We need to determine whether it's replicable. Can we copy it someplace else in the world? And has there been a follow-up? Oftentimes, best practices are static. We hear about them, and that's it. But do we know if they've endured or if they performed as promised? All this being said, it's time to turn to our panelists here to hear about their domains, the processes, the means that they have for identifying key questions, for assessing and later evaluating approaches. As you know from the program, our speakers are either directly or indirectly related to the philanthropic community. And this is the group that has been at the forefront of seeding or providing initial support for the activities that make a difference, that have an impact on a particular problem or issue. They serve as change agents, stimulators of innovation, helping to identify and support and disseminate the best practices in their areas of expertise. So we're going to turn to George Thibault, who is the 7th president of the Josiah Macy Jr. Foundation as of 2008. And immediately prior to that, he has been the vice president for clinical affairs at Partners for the Healthcare System in Boston and director of the Academy at Harvard Medical School. He was the first Daniel D. Fetterman Professor of Medicine and Medical Education at the Harvard Medical School and is now the Fetterman Professor Emeritus. He has vast experience in the field, having served as Chief Medical Officer at Brigham Women's Hospital and the Chief of Medicine at the Harvard-affiliated Brockton West Roxbury Veterans Administration Hospital. He has been chairman of the board of the MGH Institute of Health Professions, and he serves on the board of the New York Academy of Sciences, the Institute on Medicine as a Profession, and the Lebanese American University. He serves on the President's White House Fellows Commission and chairs the Special Medical Advisory Group for the Department of Veterans Affairs. And he has been a visiting scholar at both the Institute of Medicine and at Harvard's Kennedy School of Government, and a visiting professor of medicine at many medical schools throughout the United States. As you can imagine, he's been the recipient of many awards, including, I'm going to pick out the best one. Let's see. You don't want me to read them. Let's get to it. All right. Let's get on with it. It's a very distinguished resume, as you can see, and I think that Dr. Thibault is going to have some very important things to tell us about his foundation and, in general, how to make decisions about the kinds of activities that will have an impact. Dr. Thibault.
Thanks so much for that generous introduction. So I approach this as a medical educator. So that's the perspective that I bring to it and that our foundation brings to it. And that is the education of the health professions. What can we do to improve the health of the public through improving the process and content of the education of health professionals? So when I think about how that applies to the rich discussion that's been going on here, I would say there are two particular philosophical approaches, and I'll give some examples of each. The first is that the most successful models, I believe, going forward, are going to be interprofessional. So one of the roles that we play as a foundation is to try to break down traditional silos, to bring together the health professions earlier and earlier in the process of educating them, to better prepare them for a world in which they're going to be function as team members to provide better care. So we have been promoting interprofessional education by bringing together medical schools and nursing schools to actually plan their curriculum together, a rather innovative concept. And any of you that have been involved know how unusual that is. It actually doesn't happen. And we've been promoting that. And it's beginning. I don't have the answers yet. But we're doing a number of initiatives that actually bring medical schools and nursing schools together, either around specific content area, such as how do you teach quality improvement and patient safety, or around broader concepts of how will you plan a curriculum that would allow interdigitation over a 4-year period around themes such as clinical education, professionalism, systems improvement, so that health professionals enter a world in which they have the tools to work as team members and a clear understanding and appreciation of what other health professionals do. So we have a number of initiatives that are actually teaching medical students, nursing students, sometimes pharmacy students, sometimes social work students, communication skills together, working with simulation, teaching, having them have mentored experiences together, have them have clinical experiences together that will, in fact, prepare them for a world they're going to enter, whether it be in the urban environment or the rural environment in which they need to work as team members. We can break down silos in other ways, too. We can create consortia of schools or institutions by providing the incentive to say, we're only interested in giving you funding if you want to work together. So we can be a catalyst for convening across professional lines, across institutional lines, or across foundation lines. So sometimes it's by bringing 2 or 3 foundations together that we can bring about a project that we couldn't have otherwise. So I would say one major theme is the role of foundations in breaking down traditional barriers, and the model specifically of professional education that is interprofessional, that is going to better prepare a health professional workforce to deal with the issues of urban health, of women's health, neither of which can be addressed without a team approach. And that team approach must begin at the beginning of the educational process. The second theme, I would say, is that solving these complex problems not only involves having goals and aspirations and high ideals, but it actually involves learning specific skills and content. That you have to prepare people for what they're doing. And it's not just having the hope and intention of doing it, you actually have to know how to do it. So we can fund specific programs that better prepare people for special problems. One very innovative one that we've just begun funding is a new residency track in urban health at Johns Hopkins Medical School. A new program, a combined program in medicine and pediatrics, has been designed there, and we've been one of the funders of it, that will prepare a group of health professionals with a specific curriculum, a specific set of clinical experiences that prepare them to work in the urban environment, understand the special issues of poverty, nutrition, violence, substance abuse, and mental health that are particularly concentrated in the urban environment. A very unique program to give them a very specific set of skills and experience. So at the end, they emerge as leaders to be able to define the right programs to deliver care in an environment that they've been specifically trained for. So there's a very content-specific area, and we can focus our activities and say, we want to develop this content. Work in community health centers is another one. We've been promoting the use of community health centers as educational institutions so that we combine the role of a community health center as caregiver with the role of community health center as educator. Longitudinal clinical experiences in the community that better prepare health professionals to take care with disease over time and with a patient population over time in the social setting in which disease is expressed. So the foundations can play a catalytic role and should play a catalytic role. And our particular focus is on preparing health professionals by breaking down silos, by creating models of interprofessional education, and then at looking at some specific content areas to prepare people for care in special environments, in special patient populations. So I'm going to stop there and turn it over to my esteemed colleagues here and look forward to an active question and answer period.
That's really exciting what you're talking about, and we can hear from your description that the actual context in which you operate, that is your foundation, which has a particular mission, determines the types of programs that you will be engaged with. We'll ask you later about how you actually pick where you're going to put your money. At any rate, we're going to go to Bob Buckley right now, who has been with the Rockefeller Foundation since 2008 as a managing director. He provides leadership and strategic direction for select foundation initiatives, particularly for those initiatives in developing countries. He's particularly well suited to do this because he has been an advisor and an economist with the World Bank, where he served, doesn't say how long you were there. How long were you there? Too long, he says. But prior to that, he was one of us. He was an instructor. He was a teacher, a university professor at Syracuse, Johns Hopkins, and at Penn. I didn't know that. We've known this man for quite a while, and he now is telling me this. At any rate, he has been a Fulbright scholar, and he received his PhD in economics at the University of Kentucky and a bachelor's degree in economics from St. Peter's College. So Bob, tell us about your cut on all of this.
Thank you, Jeannie. Before I start, let me just make a couple of overview comments. At the first day I was here, yesterday morning, someone was saying that they like the fact that there's now on the order of 20% men in the audience, and that in the early days there were almost none. I would give you a caution on that. I think you have something great going here. There's a feeling, and I don't know whether it's Dean Mellis's hugging everyone I see, or Jeannie's bemused attitude in terms of discussing serious topics. But there is something very nice going on that I do think is involved with empowerment of women. And so I would warn you, just be a little cautious. It's not like an economist meeting or a World Bank meeting. And there's something worth saving here. And George and I agreed not to fight to show you how men behave.
We did segregate them, however.
But I guess what I'd like to do is talk about three things quite briefly in the spirit of George, and give you kind of an overview of how the Rockefeller Foundation approaches these things, and then perhaps we could drill down to it more specifically in questions. And so first I'd like to give some sense of how the foundation looks at things, and then secondly, within the scope of the topics that I work on, and that's urbanization in the global south and climate change and issues like that. And then third, to try to at least broach the topic of best practices within that kind of scope, but again at maybe a 50,000-foot level, and then the questions I hope we can get into more details. And so the first is the issue of how the foundation sees things, and there's kind of the bumper sticker, if you will, is we're trying to promote smart globalization, and by that what we mean is something that says globalization is here and there's many beneficial effects, but a lot of people are suffering some of the consequences of it as it takes place. And how can we help ameliorate those, build resilience in the communities that are experiencing that, and how can we just help people adjust so that the benefits of globalization are realized more fully by particularly the poor and vulnerable. So let me give you a sense of that in terms of perhaps the topics that have been discussed here. I guess I think there's at least three pretty much revolutions going on, and one of them has to do with empowerment of women. And I think it's not only that 50% of the population is going to have something to say, whereas not too long ago they didn't, but it's also what they say and how they say it, and kind of very much the sense of Julio Frank's sense of the concentric circles and the harmony and so forth. And that's a hard argument to make in any quantitative sense, but it's something I think you all feel, and I certainly feel, about that empowerment is extraordinarily important, and it's part of what's going on here. I think a second one, and we've had a lot of data on the urbanization. We're in an urban world now, and that's the future. And just one bumper sticker there is that of the next 2 billion people added to the world, it's something like 1.9 billion of them will be in the cities of the global south. And those of you who have gone to these cities know that there's some capacity problems in many of these cities, and that a place like Bombay, where Sheila lives, she gave the number yesterday, I think it's 55% of the population lives in slums. On the order of a quarter of the population has no toilet facilities and hasn't had them for a generation. The issues involved with that in terms of health and so forth are extraordinary. And I guess the third point, the third revolution, if you will, and it might be the biggest one of all, is the information one. Just the way we share information and the way it's processed. And I think it's changing the way we interact in pretty fundamental ways. And I'll come back to that, or circle back to that, in terms of what this conference is doing and the e-commons and so forth, and how I think that in some ways reflects that. So that's basically a very, if you would, a keyhole perspective. And if you look at our webpage, you won't see those points as vividly, but they're related to how the discussions that have been taking place here. And it is very much how do we interact and work with people, particularly the poor, in a globalizing world. If I could drill down to some of the topics, and this is something related to Sheila Patel's comments on community groups and their role in this, and the sense of urbanization and the urban world that we live in. And then finally, the health issues, what's involved with that. And so I guess I would think that one of the biggest changes from those revolutions is that the top-down, undemocratic way that doesn't empower women simply does not work. And it's not that someone feels that this is a sensitive meeting. It's a productive meeting. Women have a lot to add to this. Now they're empowered through devices of sharing information that the world has never seen before. And at Sheila's group, 20 countries or something like that, the computer does it. These people, they arrange contacts with each other that share information that, to me, the implication is that, and for foundations in particular, is no longer can we say, we think this is what you should be doing. What we're trying to do now is to work with groups that say, what do you think you should be doing and how can we help you? And that gets into the very difficult questions that Jeannie asked are, what is a best practice? What is a good organization? What is a place that you can work with and build on? And that's something that, in a sense, people have a feeling that they know what that is, but it's very hard to give it in any kind of precise sense. So I would argue that these three broader revolutions are changing the architecture of how people think about donor assistance, and ideally even aid. And I think this is you have Dr. Ramphella, who's was one of our board members in the audience, who I think had a big part in this, and Judy Roden, who was the first woman president of an Ivy League college, certainly play a role in this. And the foundation thinks about things differently and thinks about things about how can you carry this forward. If I could just kind of quickly go through some of what I might describe as best practices and do it in a bit of an order so that you can see where I'm going with this and maybe we could deal with it in questions. The first is in terms of community groups. And Sheila's organization in Bombay has what they call rituals, and they've shared this across, as I said, 20 countries and 70 cities within India. And so I was visiting Ghana and talking to a community group there about what they do. And they say, well, we do this and this and this. And I said, well, that's remarkable. That's precisely what they do in Bombay. And they said, that's not remarkable at all. We read their handbook. And so in one way, what they've done is, and this trivializes it, but they've franchised. How do you build social capital in a community? They've made it the equivalent of McDonald's. You can set up a community group and build capital that people can learn to work together. And they've done this through saving schemes. They've done it through many just ingenious ways of building trust in a community rather rapidly. And in urbanizing cities where you have extremely dense populations, there are lots of shifts and lots of disentanglements and arguments about who does what, and that's something that you need that community togetherness to move forward. So this is one thing that I think these community groups have shown, that if government, if the private sector is to involve and improve lives for these people, it has to work with organizations like this. There's just no getting away from it, and they can share techniques at low cost and very quickly about what works and what doesn't work. I guess if you go to the second part of that, as someone who's looking at cities as complex entities that are just bustling and growing and all sorts of new investments and all sorts of dislocations as a result, and that's been discussed at length, then the question becomes, what are the issues there that are most important? Well, you don't have to think about it too long to think that health has to be at the very top of this list. When you think of kids dying of diarrhea, and you think of the violence, and you think of the magnitudes of death and morbidity and so forth that have to do with the urban planning issues, the design issues, the violence issues, the issues that go from those concentric circles and how women view these issues and how they get, in fact, integrated into community groups. And I guess the point of community groups is that, and women's role in it, as Sheila said, one of the federations in India started out completely men. And I don't know what the share of women was after a few years, but just women are good at this, and they do it well, and that's just a matter of fact. And so it's a case that women working on health issues, working on community groups, is an instrument of considerable power. And as that's being increasingly empowered, I think the whole donor landscape will change considerably. I guess, I could go on with this a bit, but rather than doing that, I'd rather let Kat take over and try to answer questions as we go forward. Thank you.
Katherina Dr. Rosqueta is the executive director of, and the founding executive director of the Center for High Impact Philanthropy here at the University of Pennsylvania. This center was designed and has a mission of trying to figure out how to make investments such as are being described by Dr. Thibault and Dr. Buckley. So I'm not going to give you a whole background because I want to get right to this conversation. So what is your cut on all of this?
Okay, say you had $1 million. And you were going to spend this philanthropically. Okay? This had nothing to do with getting your name on a building. This was not about the kind of social philanthropy that we know a lot of folks engage in. This was about spending the money in a way that could make the greatest difference in improving the lives of others. This capital was supposed to be spent focused on increasing social impact. Okay. That $1 million question is what our center was founded to help folks answer. And in my remarks, you can play a little bit of breaking silo bingo, because I will, even from the genesis, talk about how the only way to answer that $1 million question is to break down the silos that prevent us from understanding the parts of the solution that, frankly, are often already there for us to pick up. To begin, the center was founded by Wharton alumni, folks who were asking that $1 million question and were frustrated at their inability to understand how to answer that well. The center is housed at the School of Social Policy and Practice. Now, for any of you who are at Penn or any of you who have worked at a university, the notion that the alumni of one school would start a center at another school, well, you recognize, and I hear a dean laughing, you recognize how infrequently that happens. I think that's a testament to both the perspective and the mission that was required to answer that $1 million question well. From the get-go, we understood that parts of that answer were in different disciplines and different sources of evidence. Some of the founding members of the center are here today, and I will say I'm the only person who came with an MBA. Hillary Rhodes, a colleague who's down here from Abt, was the only person with a PhD, hers in policy analysis. Carol McLaughlin, who some of you know, who's a real champion for public health and women's health here in Penn and beyond, was the only person with an MD. The other founding member, Kathleen Noonan, who some of you know from Policy Lab over at CHOP, the only person with a JD. Now, as the founding director, that did not make my life simple. I often describe our early team meetings as that dysfunctional Thanksgiving dinner that you have to go to and you're not quite sure how long you can take. But frankly, it was only out of that we got the kind of productive and creative friction that leads to the answers that we knew we needed to find. I'm going to step back and talk a little bit about what is required to answer that $1 million question. That is a remarkably straightforward and reasonable question to answer. How should I spend this money so it makes the greatest difference in the lives of others? For any of you, and I know my colleagues who have worked at foundations, are working at foundations, know it is a maddeningly difficult one to answer in a way that is both evidence-based and actionable. So here are the sub-questions that we needed to pose, and they're in a very specific order. First, what is the impact that this philanthropic money is aiming to target? And is it a meaningful one? One way somebody described to me how you know you've gotten that target right is that it is small enough that the organization and the model has a real chance of making a difference, but big enough that that difference actually matters. Okay, what is that impact? And we work in different areas: public health, disaster relief, education in the US. The next question. There is no social impact that any philanthropist is targeting today that is meaningful that others haven't tried to address before. So you have to then ask, what do we know works and what do we know doesn't? So that none of that money is wasted on mistakes that others have made, and so that all of it can build on the knowledge and success that has come before it. The third question we ask, and I have to say this is one of the more surprising things and controversial things that some people have said our center focuses on, and as the one MBA was one of those, I don't understand how you could not do this, which is to link considerations of cost and impact. If you look at the donor advice that's out there, so much of it focuses on impact or results. Look at all the good work that's out there. Or very narrowly on cost, I can't believe this overhead ratio. Okay? Those two are meaningless if you're thinking about this as an investment until you link the two. And it's only after answering those questions that we get to our final question, the one that you need to know in part to be actionable. Well, who are the agents on the ground who are well positioned to deliver this impact? That's what we do. I will tease out two comments that have been made before as ways to sort of highlight what's different about our work. The first is we very intentionally don't use the unit of analysis as the nonprofit. We're not trying to answer the question, what's a great nonprofit to go to? And that's because, as Jeannie pointed out, when you're thinking about social impact, it's the models, it's the best practices, it's the standards of practice that matter. And that is both a consideration of the evidence, because frankly, that's where most of the evidence is. It's on that level. And it's also what's actionable, because what we know is that, like it or not, most individual donors are quite sticky to the nonprofit organizations they fund. Even if you provide them evidence that there is another organization in their area, in their geographic location, doing a better job, they are very resistant to breaking up with the one they've already given to. So then, how do we ensure that that capital does more impact? Make sure they and their nonprofit have access to that other organization's model. Very similar to what Bob described. We read the handbook. The second is, again, in breaking silos. I have seen colleagues cringe at what my team calls evidence. Okay. There are 3 circles of evidence we source from. One is the great research that, unlike myself, my colleagues are capable of doing, that is generated at a great research university like Penn. That is never enough to answer that allocation question. So while we start there, we have to look at the fuzzier stuff. If I'm standing from an academic view, I would call that the fuzzier stuff. But it's the program evaluations. It's the stakeholder surveys. And some of it is not at all codified yet, sadly. So it's the knowledge and practical experience of the folks on the ground that you have to talk to. And that's what our team does in order to answer that $1 million question.
Thank you. Now, we've posed a theme that's sort of interesting here. George, you are training professionals. Bob, you sound anti-professional. And Rosqueta, you're looking at them both, right? So, we are in a room of professionals here. What is your advice to them? And what is your advice to each other?
Well, I come back to the 2 principles that I started with that, whoops, let me just, so my advice is turn off your BlackBerry. That's my advice. And I should have done it myself before, but I will take care of that now. Sorry. So I think we have to look outside of ourselves. We're all very proud of whatever we were trained in as a profession, and there's something important about developing that professional identity. It's a very important process of acculturation. But we are all incomplete as professionals. And most of the problems of the world and most of the significant impact on individuals or on communities and societies cannot be solved by any one profession, no matter how well trained you are. So I'd ask every one of us as professionals to look beyond ourselves. We need to be complemented by other skills, other set of world of experiences in order to do whatever we want to do. We're not complete unto ourselves. And then the second is, I'd ask, do we have, even within our own profession, the necessary skills and behaviors to do whatever tasks we're set out to do? Because just because you're called a doctor or called a nurse doesn't mean you can do the specific thing that is needed in the place you are. And if you don't have those skills, what do you need to do to get them? Or who else do you need to call on to provide those? So, and what we do as a foundation is a little bit of the extrapolation of that to a larger level. Who can we bring together to better make complementary teams, and how can we fill some gaps in that skill development and knowledge development? So I think that there's an individual corollary to what we try to do as a foundation. So I don't know whether that answers your question or not.
Begins to, Bob.
Can I make a pass? Because it really, and I meant to close with this and then forgot. It seems to me that if you take this information revolution idea, that all kinds of networks are being established. And I think the professional networks moving into networks of community groups, not just community groups, local governments, all kinds of developmental processes in which kind of the weak links, and a meeting like this where you can bring people from a range of different professions, a range of different networks, and start chatting and getting those networks sharing information can be extraordinarily powerful. So if I gave the impression that I don't think professions are essential in this, that's the wrong impression. I think it's how they play that role, and it has to be one that is responsive to what organizations in the global south want, rather than dictating terms to them. I think they have an extraordinarily important role, but not as leaders, as cooperators and as colleagues in trying to accomplish things, and as specialists who can bring value added in many different ways. And I think this so-called network revolution about information is one of the vehicles through which that can be done.
I mean, the phrase that came into my head first was, well, make yourself uncomfortable. And I think that's a hard thing to think about when the work seems so hard and there appear to be so many obstacles in the way. But I think about the things that have helped our team and the donors we've worked with actually achieve impact. And it has been things like, the very successful businessman who has never, probably for the past 30 years, hasn't really been wrong, who has talked to some doctors and nurses about his philanthropy and been told what a stupid idea it was. Or, our team that has been dragged kicking and screaming by a woman in our office, Autumn Walden, into blogging and tweeting and building a social network. Bob referred to the information revolution. We would have had no impact, no matter how good our answers were, if we did not have a way to send that out to the very fragmented world of individual donors. And the only way we found successfully to do that is through the kind of social media that I was a little uncomfortable even testing out, but someone on our team forced us to do. So it kind of as a principle, if you're willing to make yourself uncomfortable, you'll start seeing solutions that weren't so readily visible earlier.
George, we have a question from the audience. Your example about the Johns Hopkins program referred to the interprofessional nature of the program, combining pediatrics and internal medicine. Those are both medical professions. Are there other professions included? Since there are more nurses than physicians in the United States, do you have programs that fund them?
Yes, we do. And I spoke about the large number of programs that we're funding that are really bringing medical schools and nursing schools together. The Hopkins program, incidentally, partly by our intervention as we went through the iterative process, which we always do with our grants, but that is what ends up getting granted isn't what first gets submitted. now does actively include the nursing school in that as well. So these, not every program does everything that you want to do. And some of the challenge I found as really a new person in the foundation world, I've done this for less than 2.5 years now, is how do you put together a portfolio of programs that is complementary and synergistic? I don't think any single program, just like no single professional stands alone, no single program stands alone. So you're looking for complementarity. You can't accomplish everything with every program if you have a set of goals and objectives. But how can the learning from one inform the other? And then what is the mechanism? And that's another thing that we talk a lot about. How can we improve the communication so that the information garnered from something we're sponsoring here is transmitted to others? What kind of convening can we do? What kind of electronic communication can we do? And I would say we haven't fully developed those as much as I hope we will over time. And again, we want to learn from others in the foundation world and broader in the profit and not-for-profit world of how we can facilitate that kind of dissemination of knowledge and experience. Because we're never going to answer the important educational issues, and then from there the important delivery and social impact issues from any single grant or any single program, no matter how good they are.
I have to make an apology. I glossed over Katherina's description, and in the face of giving extensive descriptions to the men and a short one to the woman, it was a very shameful act. So what I would
I was going to call that to your attention.
So was I.
So I'm glad you.
That is exactly what it was. There's no introduction is needed. But I would like to bring to your attention the enormous accomplishments that Katherina has done. She, before becoming the head of the center in 2006, she was a consultant at McKinsey & Company, where she served a number of clients in strategy development, capability building, and post-merger management. And you can see from her discussion today that she's employed these talents very, very effectively as a leader of the center. She's had numerous volunteer and civic leadership positions, including being the board president of La Casa de las Madres in San Francisco's oldest and largest shelter organization for battered women and their children. She was chair of the United Way, the Bay Area Week of Caring, and co-founder and executive committee member of the Women's MBA Network. She's currently an advisor to Charity Navigator, America's largest charity evaluator, and is on our, at Penn's, Social Responsibility Advisory Committee, which advises our Penn trustees on issues related to proxy voting. So again, this experience has really added to your capable leadership of the center. And finally, she received her BA cum laude from Yale University and an MBA from the Wharton School. So apologies, but here we are. At any rate, maybe we should probe a little more deeply into how you choose the projects. You started to talk about that. You tried to find complementarity. You tried to take your resources. No one has infinite resources, so how you can maximize your resources in ways that will make an impact. And then finally, how you judge that impact. We've got Katherina here who judges it very quantitatively, we think, but I'm not sure. And sometimes projects take a much longer time to develop an impact, so I'd be interested to hear from both Bob and George how you view the idea of judging impact and choosing projects.
Well, I think that's one of the greatest challenges we face in the foundation world. And when I became a new foundation president 2.5 years ago, I made the rounds of foundation presidents and asked them these questions. And I got very varied answers, and I got, I think, in most instances, pretty honest answers that almost everybody acknowledges that they don't know for sure. I mean, the selection process itself is an important beginning, and that is both to define clearly at the beginning what the expectations and goals are, what are the metrics that are going to be used, where does it fit into a plan, and we look, of course, for originality. You know, a lot of people submit grants and they say, well, we looked up what you funded before, and we've seen you funded several things like this, so we think you'll fund this. The odds are that makes it less likely that we're going to fund it if we've already funded several things like that, unless there's some important nuance on it that's going to add to what we've learned before. So we're looking for originality. We're looking for doability. That is, are the people proposing it capable of carrying it out? They could have a great idea, but you say, gee, they just don't have the wherewithal there to do it. Is it sustainable, both in the institution or group of institutions that are doing it and beyond? There's a lot of history. You can go around the country and find some very good things that were started, and as soon as the funding went away, they disappeared. So you want to ask that sustainability question from the beginning. Whether it's are the institutional resources there to keep it going? Do they have connections and other opportunities to keep it going? And then it's generalizability, because you're always looking for impact beyond the nidus that you've started. The circumstances, they are so unique that even if they were able to pull it off, it could never go beyond that. So those are some of the questions at the beginning, and have you set out clearly enough what the goals and expectations are and what the metrics are going to be? And then how do you follow up on it? And I would say the follow-up for all of us, and I speak for ourselves as a foundation, but it's also what I've learned in going around and querying others, has not been historically as systematic as it should be. I think that the efforts to kind of bring a more quantitative approach to that, if you will, the more business school approach to it, has been a healthy one, understanding that some of these social interventions that we're talking about are not quite as quantifiable as a profit and loss statement. And, did your sales go up or did your sales go down? And we're dealing with social outcomes in the educational realm, in the healthcare delivery realm, that are not often as easily quantifiable, and where the impact may be very long in coming. Seeds are planted, and it may not be a decade before you know whether you've really changed things. So that means, and that's another thing that we're just beginning to think about, how do we build into a funding cycle that often for us is a 3 or 4 year cycle. Some foundations are involved over a much longer period of time, but we've generally taken the view as a smaller foundation than the Rockefeller that we need to kind of keep reinvesting our resources in new things and move them around, as opposed to thinking that those resources are going to stay in one place for a long time. But have we built in the capacity to revisit at some time down the road? And I'm just involved in doing that now, something we've not done before. Go back to something that was viewed as a very successful thing. They've actually finished funding on 10 years ago, and go back and ask the question now, what has happened since then, and can we evaluate what impact has been a decade later? We've actually never done that before, and I'm very excited about that. So this is a very important question. I would say as a newcomer to the foundation world, I'm still learning about it. I think the foundation world itself is still learning, has moved more to measurement and quantification, but I think it gets expressed differently, and I'd be very interested to hear the perspective of the Rockefeller Foundation on that.
Well, I'm kind of new at this too, but let me nevertheless speak up. I guess I liked Kat's perspective, and I think of a lot of what we do in some ways are kind of venture capitalists for social returns. And so you're trying to pick things that have a high social impact, but not necessarily a financial return that people can appropriate. And particularly not that financial, because otherwise it would be seized. And so the sense is, what types of innovations can you get at that indeed can bring leverage? And, we're not a large foundation either. It's a sense of, we feel to do things that we have to bring others into the game. And that is not necessarily resources, it can also just be intellectual. How do you bring people to look at an idea differently, to think about it, and to convene scholars together to say, how do we rethink or reimagine this issue? And so, but leverage is something that we think that's given a lot of attention. Another one is the sense of kind of self-replicability, the sense that you don't want to give a grant to someone who has the feeling that they just won the lottery. It's more the idea that they've got a grant, and with that, they have a system in place that it generates out from the system. The story that I was saying about the low-cost way of sharing information across networks. And so that type of system, and I think that sort of new information world is pretty important. And if we could go to the evaluation side, I share with George the sense that quantification of lots of these issues, you have to be a bit patient. It's going to take some time to tell what worked and what didn't work. But nevertheless, I think the exercise that Kat is alluding to is that trying to set up rigorous questions so that you can draw inferences about it is a really healthy exercise, and one that in the short time I've been at the foundation, I've seen in the past that wasn't done as much. And so the sense of this was a good area to be in, I don't think works anymore. I think there's a sense of why do we think it's a good area and what kind of indicators do we have of that, recognizing that if you put too much emphasis on the indicators will be gamed themselves. And so it is a difficult area, and if you take Kat's perspective, she didn't say but implied, of kind of a social venture capitalist, it's not something that there's a cookbook to. There's something that takes a lot of thought, but thinking about it and trying to get it in ways that you can have indications of what's working and what isn't and who else you're bringing to the table are important issues.
So, Kat, can you give us some examples?
Yeah, well, I'd like to address the notion of quantifying social impact and how you go about using metrics for philanthropic decisions. Warren Buffett, who was very successful in making a lot of money, once said, "I never chose a company on the numbers." Okay, so this notion that it would be any easier to invest in a model or a nonprofit organization based on numbers is sort of patently absurd, because the work of social impact is the work that has been resistant to solutions from either the business or the government sector, right? So we're working on the problems that were so tough that the other sectors were not able to pick it up and come with the solution. So what that means is, it's basically just another way to say what Bob said, which is metrics inform decisions, inform judgment. They are never a replacement for wise decision making. And now, that said, one thing I have found in my first work, working with researchers who understand hard evidence around impact, and with nonprofits, is a resistance to doing the kind of back-of-the-envelope estimates that are useful. It's you've got your gut and a back of the envelope. Your gut alone may take you far, but your gut and the back of the envelope is even better. And so just because you don't have the best numbers, I would encourage folks to think about, what's the quick relationship I might be able to figure out here? And given that quick relationship I figure out, that might lead me to understand where to focus.
I have a question here that I think will bear some interpretation by both of you. This is the question, and George, you did allude to the fact that you shape applications. And so this question is very much related to that. Here it is. Sometimes there's a tension with donors and the global health practitioners seeking funds. Donors can truly sway the work that we are depending on their personal funding interest. How can we ensure that donors are responsive in a long-term way to the needs of global health practitioners? How can we hold them responsible? For example, if a donor funds vaccines but then decides to fund climate change, what do we do? So you have the changing portfolio that a donor had, but also oftentimes there's a shaping aspect of a donor's approach to funding.
Well, there's always the danger of wanting to talk people into doing something that you want to do, which isn't what they want to do, but they want the money, so they'll do it. And that's a danger that we all have to guard against. So is there mutual agreement. And sometimes I'll say to somebody after a series of conversations, you know, you've got a very good idea there, but it isn't what we're interested in now. It's probably better if you go elsewhere and look funny rather than try to turn it into what we're interested in. So I think there is times in which by mutual agreement you decide there's not a match, and you shouldn't try too hard to make a match that isn't there. And I'm very cognizant, I was warned about this when I took the position, and something I try to remind myself of regularly, that just because you're running the foundation doesn't mean you know everything. And I know that that's true. But we do try to fit things into a portfolio and say, you know, this is what we're interested in now. It doesn't mean it's the only important thing in the world, but this is what we're interested in now, and we need some coherency to what we're doing. And as I've both looked back at the history of my own foundation as well as look at other foundations, if you get too scattered and too diffuse, you have less likelihood of having impact. So while some people may be disappointed that we don't want to support what they are proposing, even though it's a very good idea and very well thought out, I think it's important that each foundation try to find both its niche and where it can have its collective impact, and try to stay with that then long enough to follow through. So this idea of matching the donor or foundation mission and strategic plan at the moment with where, with the right targets out there is an important process. And I find that I do a lot of that personally. A lot of that's based on conversations back and forth. I can't tell often. I can't tell just from the written word whether that connection's there. And I do sometimes try to help people then find somebody else. Say, you know, this just, the fit isn't right. Maybe you should go talk to X, Y, or Z. So I think that's very important that that process take place. And it's not just about getting money if you're at the receiving end. It's not just about giving money if you're at the donor end. It really is about making the right match. And there's a process of education and self-discovery that's a part of it. And the learning has to be on both sides, of course. So that's my take on that.
I would just add a couple of things. One, I really like George's point about portfolio, and I think that characterizes a lot of how we think about things too, and the portfolio of what's a risk and what isn't a risk and so forth, and having a balance between that. But just to give one historical reference point that affects this kind of decision-making or two reference points. One is that in terms of the Rockefeller Foundation, which has been doing this for 100 years, up until World War II, the foundation had provided more aid to developing countries than the U.S. government had. I mean, there just was no U.S. government foreign aid. So in that kind of context, Rockefeller invested in the Green Revolution and lots of knowledge-based innovations that took a long time to proceed, but in the end were extraordinarily productive. Now, if you think of the scale of the foundation in terms of the grants that multilateral institutions, the U.S. government, the list of donors, it pales in comparison. So it's no longer this player that's alone on the stage, if you will. So it has to act differently, and it has to act, and that's part of the point of going to leveraging ideas, leveraging examples, and trying to be closer to things that are in fact on the ground. And then I guess the second point, and it was quite specific in terms of shifting topics, I would guess that probably every 10 or 15 years you get a change in, just as you get Sam Walton changes, you get a change in the president of the foundation. And that president tends to change the cast of characters involved. And so just again, if we go back to our venture fund model, it's quite reasonable that you'd get a different perspective of what are the things that are on the cutting edge, that are the most important things that we should be doing. that, there is, of course, an enormous responsibility to that, but our most immediate responsibility is to our board, that our board says this is something they've thought about, and it's not just a cavalier shift in attitude. It's something that the world is changing, our role in that world is changing, and how do we best position ourselves to be as helpful as we can be?
I think you brought up a very interesting point, which is how does a foundation decide what its priorities are? What is the dynamic between the board and the chief executive, program officers, the advisors you might have with whom you talk? How do you set your priorities? How do you decide what's going to be important for you to be investing in?
Well, it's I think it varies with foundation. We're a relatively small foundation, so it's I serve as president and really principal program officer. So I really am personally involved in all of our grant giving. Now, in a larger foundation, that isn't true. There's delegated responsibility, but it still has to emanate from a strategic process. It is ultimately the responsibility of the president of the foundation reporting to a board, and the board plays a very important role in our foundation. I think it does in most of the ones that I know about, in setting the kind of strategic direction of the foundation. So I worked with my board when I came in. I was recruited to kind of take a fresh look at a foundation that had been very successful. The previous president had been there for 11 years. I think there's these natural cycles. It's a good time to take stock. The world has changed. Where can we have our most impact? We stepped back. We undertook a process where we did get some outside consultation that did some benchmarking with other foundations, looked both at our operating practices and how we compared, and did some survey of both our grantees and other people in the field about how they felt about their work with us, how they felt about our impact. I did a lot of visiting around the country, both of other foundations and people in the health professional world, both to hear ideas that were out there and to get their impressions about some of the work that we had funded in the past. I actually visited many of our grantees. And over a period of about a year and a half, articulated a plan that included both some operational changes in the foundation and what I felt was a kind of a sharpening of our focus in terms of how we were going to use our grant giving activity, cluster it more consciously than we had before, and also link it more consciously with other activities that we are doing largely around convening, conferencing, and bringing people together for consensus and recommendations, and how we might more closely link that around a specific kind of overriding theme of this concept of aligning health professions education more closely with societal needs, which of necessity, and again it reflected my own background, and I think anytime a foundation recruits a president, it does it with some idea in mind of what it wants. We don't all come the same. We all come with a set of personal experiences, professional background, expertise, content, and knowledge that's a little bit different. And mine happened to be much more in the clinical domain than my predecessor had been. So the orientation of the foundation has become more clinical. It's become more focused on the preparation of health professionals for the delivery of care. Now, there are other directions you could go in and still be in the domain of medical education. But this is the one that we agreed on that was partly a result of who they recruited to take on the role, and then a process that we undertook to both listen to the public, listen to our grantees, look at our strengths, and look at where the needs were. And now that general outline will be our guide for at least the next several years. Not that it can't be changed again, and not that everything has to fit into that. I think we still see the want to seize the opportunity to do something that just looks like it's really unique and refreshing, that may not exactly fit, but might give us some new ideas. The board approves every grant over a certain amount. The board meets 3 times a year. I prepare the documents for the board to review. But the final decision is to sign off by the board, so that while I'm having all this interaction with grantees, it's always with the knowledge that the ultimate decision is a board decision made in a rolling fashion 3 times a year. So that's our process. I think it's not dissimilar from other organizations, but every foundation I've found kind of does that slightly differently. Again, partly reflecting on size of foundation, how big is the staff, how much of that responsibility is delegated. But I think that gives you a sense of how we try to approach it.
I'm going to focus on individual donors because that's the target audience of our work. It's based in part on an assumption that particularly the larger foundations have staff to do some of the kind of research that we're able to do. If you don't know this, you should know some facts about the philanthropic world more broadly. One is that 80% of philanthropic capital does not come from corporate or large foundations. It comes from individuals. And any of you who have fundraised know that that's the grade A prime capital, right? Because that's the unrestricted. More individuals are willing to give unrestricted funds because they aren't necessarily beholden to a board with a focus and other priorities. The other thing to know about philanthropy with individual donors, not only do they make up the largest share of the capital that goes to social impact, unlike in their financial dealings, there's a structural problem with the way social impact is funded that makes it difficult to actually tie to social impact. So there's a beautiful circle in the for-profit world where the provider of the capital is the beneficiary of good performance. Whether the person who's providing the capital is an investor, good performance on the part of the firm, oh, look at my earnings. Or it's a customer, I buy something, I give you capital, and if you give me a good product, I'll keep buying, right? It's a virtual cycle. We all know that the providers of the capital for social impact are not the beneficiaries of the good performance. So it's broken. So I'll throw out some wacky ideas that are out there to try to tie that. Now there's one with, well, it's just an inefficient market, and what would tie it is if people just knew better the performance of the social impact models. That the real issue is that people are well-intended. If they knew that something was working, well, then they would fund it again. But as I said, sort of structurally, they're not the beneficiaries. So even with that evidence, you're just hoping that people are good people. And I'd like to think most people are, but that's not the same kind of structural incentive that you have elsewhere. Bob Eggers at DC Central Kitchen said, well, what if we, instead of a one-time tax break that happens before any social impact work is created, why don't we give them a bond tied to social impact over the 10 years? Because that's how long it takes for any kind of change in some of the work we're doing. What if we tied the tax benefit to the amount of good their charitable donations made? I mean, I'm sort of throwing these out there as the kind of wacky ideas because part of the reason the work is so hard is that capital, philanthropy, and those creating the social impact, they're not the same agent.
We have time for 2 more questions, one coming from the audience, which is, we've learned a lot from successes, but what about your failures? I'll give you that, Bob, first, and then we'll turn to...
We have a rich litany of failures.
You've only been there a year. Come on. You can't have that many.
But I think to go to George's earlier point about portfolio, that and Kat's point about it's not so simple to identify the winners in the area. And so I think a foundation should be willing to take chances and be willing to take failures. And so the sense of that there are, but it should have some sense of where it is in the spectrum of that. Is the whole portfolio there, or is some portion of the portfolio there? And I think in general that's the point in some sense, that if you're not going to have failures, you're not trying hard enough, and you should be pushing the border on things, and particularly innovations that others don't want to undertake. Or I love the story of this urban health at Johns Hopkins. I think that's the type of, if a school like that does it, that could really get traction to it. And so to me, that's a winner. You know, that's unlikely not to win. But you know, a climate model for Ethiopia, as important as it is, if you could get that to get early warnings about drought and what's going to happen to people, draw down on their capital and they're ruined, you know, that's a risk. That's one that the implementation risks are enormous, and that's why in some ways there isn't such a mechanism in place. And should a foundation invest in that? Well, there's no unambiguous answer to that, but that's the sort of thing that we have invested in. And so it's, you know, this is a long way to say there's no simple answer, but we should be willing to bear some failures.
I think his name is Ben Zander. He's a conductor. He often does sort of motivational speaking, and he once addressed a group of McKinsey directors and said, every time you fail, you should say, Eureka, I've learned something. And to me, that's the only real failure is failing to learn from the mistakes and failing to share what you've learned with others. And I just think the nature of our work is we've got a gazillion mistakes behind us and a gazillion mistakes in front of us, right? I mentioned this is tough work. You know, during cocktails, I can talk about all the mistakes that our team have made and that we've seen. But I think it's really hard for us to continue to be willing to make the mistakes. I think that's probably the most important thing for us, is that particularly now that our center's work and the organizations we're working with are better known, it's often more risky for us to make mistakes because people are looking at us more. And we got to keep making them because that's the only way we're going to be able to learn and do better.
Can I just make one more comment?
Of course.
I heard Bill Gates answer a similar question, and it was with respect to, and I think it was his foundation's investment in malaria. And he said he was told that when he was making this investment, I think it was $500 million. It was a lot of money. I forget the amount, but it was just a startling large sum. He was told that amount had never been done before by a private philanthropist. And he was told that the problems are there's 3 mutually exclusive ways that it can be addressed. And he said, what if I wagered on all 3? I fail 2, but maybe I'll get the 3rd. And he thought that was a pretty good wager. And I think that's a good idea. You know, it's a way of thinking about it. If you can narrow it down to there are 3 good bets here, no one has done it, and he had the resources to do it, you know, it is the sense of that's 2 out of 3 are failing.
Well, if you have the resources, and if you wouldn't diminish your resources
right.
by spreading your risk, I mean, that's what any investor does, right? And so you have to figure that.
Well, I mean, it also is, I'm not sure how to get around this, but there's a venture capital firm called Bessemer. I think every year they have a list of their worst deals. How helpful would it be if every foundation had a list of their worst investments, and here's what we learned and what we're going to share with the rest of you? I mean, there is a culture of risk tied to performance that's, I mean, it's not a comfortable place to be, but that is where a lot of the learning is.
And I agree with all that. I would just say the foundations should fail if we are so cautious that we're only betting on sure winners and we're not playing our role in society. And I struggle with that a lot because sometimes when you're looking for impact, you will tend to gravitate to those that already have the best track record. And then sometimes you ask the question, well, you know, did Hopkins or Harvard really need our money? Maybe they could have done it anyway. So there is this tension between going with winners that make you feel good and kind of get your name of your foundation out there, and then taking some chances. And I think we need to do some of both. And if we never take any chances, then I don't think that we're performing our function of filling in the gaps and the voids, of doing the things that people couldn't have done in any other way. Now, having said that, I don't know what the right percentage is, and as we already said, it's also very difficult in the short run to make clear judgments about what failed and what didn't fail, because maybe you planted some seeds that are still going to come to fruition 5 or 10 years from now, even though it wasn't obvious to you that it was a success. But foundations should take risks. If we become so cautious that we behave like, companies that have to look for their returns every month, then we're not performing the social function that I think we should be performing.
So did some of your activities get curtailed as a result of 2008 and the financial crisis?
Oh, everybody took a hit. We took a hit about proportional to others. We made a decision, again with the support of my board, that we were not going to stop spending money. We did scale back some on our operational expenses, and made the decision that it was very important, because we really were feeling like we were beginning to get some traction of having impact on educational reform at a time that healthcare was changing so dramatically. We thought this was an important moment for us to be visible, that we were going to continue to give grants at roughly the same level. We did reduce the kind of average size of grant, but not the number of grants that we gave. In fact, I think I even gave more grants in that year. And part of what it engendered that was actually very healthy, because everybody knew what was going on in the world, is how can we make this happen with less money from the foundation? Got more institutional support in some cases found partners, and it actually ended up being a fairly healthy process. But we did continue to give, and we cut a little bit more into our corpus in order to continue to have a high profile. All of this, obviously, with our board approval.
Go ahead, I'm sorry.
The good news, though, is I was talking to folks at Fidelity, which is the biggest charitable gift account group, donor-advised funds. They actually saw an increase over last year. So while it's understandable...
This past year has been good, yes, exactly.
So understandably, when you've got the foundation assets, because of its tied market, at the same time, it does seem like individuals did step up.
Yeah, I should make it clear, because it may not be obvious to all of you, and I didn't. So our foundation is totally dependent on its endowment. We do not raise money, so we're not taking in donor money. So we were entirely dependent upon what happened in the marketplace to our endowment, not on whether we got any new money in it or not.
I'd say there was a 30% reduction in wealth, and we were hit by that, and all foundations were hit by it that are reliant on endowment. In general, though, we followed a lot of smoothing techniques that really made it relatively minor. It was more administrative cutbacks and a pause a bit. And there was also an effort to reach out to those grantees who were troubled, who were so in need of another grant that we provisioned extra money to consider them with greater consideration. So given the scale of what took place, the changes, I think, were almost unbelievably mild.
Pretty good news. Yeah. I have a pile of other questions we're not going to be able to get to. I hope people will approach you afterwards and ask these questions. Some are quite particular to your individual foundations. But I have a general question that we've been asking all of the panels. We have a room full of individuals engaged in addressing the issues facing women in urban areas for solutions to expand and enhance their efforts. I ask each of you to share one tangible, actionable idea that this group can take back to their own communities to help improve the lives and health of women in urban areas today. Who would like to start?
Well, I'll follow on the breaking down silos that I began with. So I'd ask each of you to think about some problem you're trying to solve and ask yourself, who have you not yet reached out to that could help you solve the problem? Cross over institutional lines, professional lines, maybe to an antagonist, and get some opportunity to bring new people to the table to solve a problem you haven't been able to solve before.
guess I would say tenacity. This is a tough area, and I think if I've learned anything from Sheila and her company is they keep talking and they keep at it, and you'll often hit brick walls, but the world economy is going this way, and things are happening this way, and it's an extraordinarily exciting time, and keep at it, and even if it's sometimes crushing.
Do the back of the envelope. It'll get you far. And I've just seen far too many people who, they were just a little nervous about doing it. It wasn't rigorous enough, and once they did it, they saw all sorts of things.
Thank you to the panel for your wonderful insights, and I think we're off to another break.